Hello, everybody. Welcome to Chapter 35 Mental Health Disorder. This is a big chapter, very interesting. We begin our discussion of mental health disorder with basic concept. Mental health relates to the mind. When we talk about mental health disorder, we are focusing our discussion on the mind, how the mind is functioning. Mental health and mental health disorder involve stress. Always, human body responds to the stresses, and mental health is really directly related with the stress level. Stress is the response to a change in the body caused by any emotional, physical, social, or economic factor. Basically, our stress level is caused by these four realities. One is emotional. When person is emotionally disturbed, the stress level goes high. When the physical level, when person has more stress as physical level, the person has got the stress level very high. When a social means the relationship with other people in the society is not going very smoothly, person has a stress. And economic factor, when the financially person has difficulties, person's stress level goes high. So basically, emotional, physical, social, and economic factors are the real cause of our stress level. And mental health means that the person copes with and adjusts to everyday stresses in ways that are accepted by the society. So, who is a mentally healthy person? The person who can cope with and adjust the everyday level stresses in an acceptable way in the society, that person is considered a healthy person, or let's say the mentally healthy person. A mental health disorder, on the other hand, is a disturbance in the ability to cope with or adjust to stresses. When a person has stresses, whatever is the region of the stress, we already discussed that we have a four basic region of the stress: emotional, physical, social, or economic factors. When out of these four, any of them, if they are causing the stresses, and the person is not being able to handle those stress, manage the stress, it's called stress management. If the person fails to manage the stress, the person is not mentally healthy. And mental illness, mental disorder, emotional illness, and psychiatric disorder also mean mental health disorder. Let's say the four terminology, these four words are contributing to mental health disorder: mental illness, mental disorder, emotional illness, or psychiatric disorder. So, our job as a personal support worker, we have to always follow the concept of DIPS. DIPS is the way when we give care, when we are caring to the mentally stressed person, mentally disordered person, we have to follow this principle of DIPS. The D means dignity, I stands for independence, P is preferences, where the person has the choice, and P is a privacy, and S is a safety. So whatever is the situation, we are caring the client, caring the person, caring the patient, and while giving them care, we always have to think that they deserve certain dignity, certain prestige as a human being. We have to respect their prestige. It is independence. Independence, our main goal is to make the client independent, healthy and independent. And another is preferences, that is the choice of the person. What the person choose is the main thing we have to follow. It's not that we choose, it's the client choice. And P is privacy, always maintain the privacy while giving them care. And safety is always the most important concern of everybody. Everybody needs to safe. We have to give them safe care, and this is following the principle of safety. Remember, DIPS when providing support to a client with a mental health disorder. Always follow the principle of DIPS. See, providing compassionate care box 771. This box 771 totally discusses about the DIPS, which we already discussed here. Because your client may have been exposed to negative attitude in the past. So we have to change the negative attitude of the client. Because of the negative attitude, the person's stress level might have gone beyond the maintenance level. The stress level has gone so much high. In the past, because of that person's attitude, the stigma may be there in the mind. Stigma is certain images, stereotyped. Your attitude is particularly important. Now, the person has a negative attitude, and what should be your attitude? Your attitude should be very positive attitude. You have to approach the client very positively. Ask the client what is his preference, how we can manage their independence, how can we provide their preferences, what is their privacy, how they want to give the care, and how can we give them safety. All these things we have to follow. Pay special attention to your verbal and body language, because language carries your intention. If you speak in a positive way, that gives positive feedback to the client. If your body language and your language is derogative, if your language, you intend something and tell something, if you use certain symbolic language, that's very difficult to understand for the client. So always pay special attention to your verbal and body language. Impact of mental health disorder. So now every sector of the society is impacting because of the mental health disorder. Everywhere people have the issue, people have a complaint of mental health disorder because they are unable to manage their stress level, maybe emotional, physical, financial, and so on. Over 1 million Canadian, see the number of Canadian people. We can just remain with our mouth open when we see those data. Over 1 million Canadian currently live with severe or persistent, means continuous, persistent mental health disorder. See, over 1 million. Canada's population is almost 35 million plus minus. So 1 million people, they live in a severe, very, very unmanageable way or persistence, like continuously they have this disorder of mental health. Schizophrenia, this is very violative type of disease. Schizophrenia affects 1% of the population. Anxiety disorder affects 5% of the population. Anxiety disorder, see, 5%, 5 people in out of 100. Suicide rates in some Aboriginal, means the Native American, the Native Indian, Red Indian people, our Native communities people, suicide rate in Aboriginal communities are the highest in the world. See, suicide and the Aboriginal community. Remember, if you have the Aboriginal client, make sure you are following the safety very carefully, because their suicide rate is very high in the old age, even in the young age. It is estimated that by 2020, which is today, this year, depressive, remember 2020 and depressive disorder will be the leading cause of disability leading cause of disability, depression and disability in the developed country like Canada or the United States or European countries. Let me join with this growing contamination of coronavirus. It is causing depression to everybody, including you, including me, and everybody living in this country. All people are dying, and healthcare worker like support worker, RPNs, registered nurses, doctors, they are working as a frontline healthcare workers and risking their life. Everybody is depressive, and the family members at home are depressed. They are fear of getting contaminated with those virus. And see, the situation is very, very serious. Let's understand in the realistic way. So, again, the causes of mental health disorder. Let's see what could be the causes of those mental health. It's a biological factor. Certain people, they have certain biological condition that causes them. Maybe the chronic diseases, like so many diseases may cause mental health. Childhood experience, certain child are exposed to certain situation like PTSD, post-traumatic stress disorder. When a child sees somebody is killing somebody, the child has those mental health issue in the adult life, and the child development is impaired by those experiences. Social and cultural factors. Some society have certain practices that leads to the mental health, and certain cultural factors are also there. A stressful life event, when a person sees very unwanted and very fearful, very dreadful events in the life, then the person may have certain post-traumatic disorder. Poor physical health of disability, when somebody is disabled and the person's living standard is very, very poor physical health, and the person is already disabled, this it is the disability, the person is very prone to get certain mental health disorder. Now let's about how culture is caused. So how can we relate culture and mental health? Influence of culture on mental health disorder and the treatment. What is the influence of culture in the mental health disorder? Let's begin from that. Culture influences understanding of mental health disorders. When we study certain culture, it helps to understand the mental health disorder of that particular cultural community. Client in some culture may find it difficult to seek medical attention. When a person has certain medical condition, mental health disorder like depression, like high level of stress, unmanageable stress level, person feels very, very shy, and person doesn't want to seek any medical attention for their mental health disorder. Interpretation of sign and symptom of what some call mental health disorder varies from one culture to another culture. Mental health disorder may have certain sign and symptom, but those sign and symptom is different from one culture to another culture. So what is considered appropriate in one culture, what is considered appropriate in one culture may be inappropriate in another culture, because in different culture we practice a different thing, we have a different belief, and certain cultural condition it defines that is appropriate, but another culture defines it is inappropriate. That's why one culture is different than other culture. Therefore, one culture, how the culture thinks to the mental health differs from another culture. Now we shift our discussion to refugee have a unique status. Who are refugee? Refugee, they are politically politically, when people have a difficult life, they come to another country and they live, they apply for the document, they are the refugee. Many have experiences in imprisonment. Some are put in the jail. Imprisonment means putting somebody in the jail. Torture, that's the physical or emotional level. It could be physical or mental torture. And murder of family member. Some people, they see their family member being killed by other people. Extreme hunger. Some of the countries in the world, they suffer extreme hunger. There is a drought, no rainfall. They cannot cultivate, they cannot grow crops, and they have extreme hunger and poverty. That's why they go to other countries in the name of refugee. So because of those negative aspects of their life experiences, it also causes mental health disorder. Another is acquired brain injury, which we call ABI in nursing. ABI, acquired brain injury. Please be mindful of the abbreviations. Are any type of sudden injury that causes temporary or permanent damage to the brain? Yes. It is also called, there are certain injury that temporary or permanently they damage the mind, they damage the brain, and that causes mental health disorder. It is also called traumatic brain injury, TBI, traumatic brain injury. When certain trauma is there, when certain blow is there, when somebody falls from the stairs to from the third floor to the ground, it's a trauma in the brain. That is a traumatic brain injury, and it is also one of the region of mental health disorder. It can be the result of trauma to the head because of the heavy stress on the head, physical stress on the head. Stroke is a disease because of the stroke, or tumor, because certain tumor develops in the brain, in the head. Lack of oxygen, when people have a very poor circulation, because blood carries the oxygen, you know it already. Therefore, when people have a circulatory problem, the oxygen in the mind is not enough, and that's called the lack of oxygen. And certain illness like meningitis. Meningitis is the head, the layer in the brain, and itis is the inflammation. That is called inflammation in the skull, in the brain. The outside the brain, there is a gap, and there is a fluid in there, meningia, and the fluid is inflamed, and it's called meningitis, inflammation in the head. That also leads to mental health disorder. Let's begin the discussion with the associated problem of acquired brain injury, attention and concentration. People with the acquired brain injury, when the head is having certain level of trauma, person's attention is impaired, person cannot focus on certain thing, the concentration is disturbed, the loss of memory, person doesn't have the good memory, what the person was doing at that time, person cannot verbalize, cannot use the language, memory is lost. Orientation to the person, place, and time. We have discussed orientation many times in our classes. So orientation is, it's a confusion of the person, place, or time. When a person cannot say who the person is and what time is there and where is the person actually is, the person cannot say. That's called disorientation times 3. Person, place, and time. It means the person is not able to tell who he or she is, where he or she is, and what time of the day is that. Now, because of the head injury, decision making, a logical thinking type of functioning of the mind is also impaired because of the head injury. Now, the person cannot do certain problem solving type of activities. The mental functioning, the mental apparatus of the mind is totally disturbed. by the head injury. It's called acute brain injuries and acquired brain injuries. And learning new information. Person cannot have the ability to learn new information in the mind because the mind is full of the trauma, and because of that trauma, the mind, the function, the usual function of the mind is totally disturbed. Similarly, headache, when person has a severe headache, person has a difficult time to memorize the thing, to function in a regular way. Fatigue is a tiredness. When people are severely tired, fatigue, they feel sleepy and they cannot do the work actively. Dizziness, the person has a dizziness. Dizziness, when person see the different images coming in front of the eyes, dizziness. Uneven gait. Gait is the balance of the body. It's called gait. Remember, it's a little bit tricky word in nursing. Uneven gait, person cannot stand properly and walk. When the gait is even, person can walk. Nausea, person has a nausea, another symptom. Visual disturbances, person's vision is totally impaired. Person sees sometimes yellow and green lights in front of the eyes. Seizure is just lying on the floor and starting shaking the body. Sometimes people even die by biting their own tongues. They put sometime object in the mouth. That's very life-threatening condition, seizure. Change in the eating or sleeping. Some people start eating a lot, and sometimes people do not eat or do not sleep at all, like insomnia, lack of sleeping. Loss of one or more senses. What do you mean by senses? It's all about the five sense organ. Eyes, nose, mouth means tongue, skin, all these five senses. Or loss of one or more senses also, person is unaware of many things. Now let's begin. The first mental health disorder is schizophrenia. Let's pronounce the word once again together. Schizophrenia. Pronounce from here. Schizophrenia. Spectrum. Spectrum means a broader symptom. It's not a typical one symptom. It's a broader symptom disorder. Schizophrenia spectrum disorder. Under this spectrum, many more sign and symptom and other diseases may occur. These are the severe chronic disabling brain disorder. Disabling means making it disable. Not being able, but the opposite of able, disabled brain disorder. Affects 1% of Canadian population. 1% of Canadian population suffers from the schizophrenia spectrum disorder. It's a chronic disabling brain disorder. These disorders affect a person's ability to function in all aspects of life. See, a schizophrenic person is unable to do self-care, activities of daily living, personal care, cannot make a good judgment, has a problem in critical thinking, logical thinking, rational thinking, usual thinking, as we do. People with schizophrenia spectrum disorder display one or more of the following sign and symptom. Psychosis. Psychosis, this is a severe condition. See, it's a state of severe mental impairment. Person is very, very violent sometimes. Person use very, very unacceptable word. Now is delusion. It's a fixed false belief. Delusion. Person is delusional. Another is delusion of grandeur. Grandeur means greatness. The person has a great exaggeration that the person feels that he is the prime minister of this country, something like that. An exaggerated belief of one's importance, wealth, power, or talents. The person is very, very talented, very, very important. Person is very wealthy like Bill Gates. Person is very, very powerful like Prime Minister or the President. And the person is the most talented person. That's called exaggerated. It's more than the reality. It's making something very big. Another is delusion of persecution. See, the delusion, there are so many delusions even. The false belief that one is being mistreated, delusion of persecution, abused or harassed by other people. If a person with the delusion of persecution is your client, the man with this mental health disorder, the client will tell other people that you mistreated him or her, you abused him or her, you harassed him or her, like physically harassed, sexually harassed, emotionally harassed. There are so many type of harassment, and the person verbalize that. Hallucination, it is another sign and symptom of mental health disorder. Basically, all these points are the sign and symptom of schizophrenia. Again, these sign and symptom may be utilized to other mental health disorder as well. Hallucination, how to pronounce the word hallucination, seeing, hearing, smelling, or feeling something that's not real. A client with hallucination may see a tiger approaching him or her. He might or she might be hearing that something very loud noise of bomb blast is there. Smelling. The person smells that something somewhere there is a fire. There is a smell of fire. Fire. The person starts crying and yelling at other people and calling other people. Something like that happens when the person has a hallucination, which is not real. Actually, what the person feeling is totally false. It's not real. Paranoia. Paranoia is another sign and symptom. This is an extreme suspicion. It's a doubtful about a person or a situation. The person doubts that something horrible is being happen, but nothing is happening outside. The person sees through the window and sees something terrible is happening outside. The client with schizophrenia has a severe mental impairment. Severe mental impairment, see the terminology. Severe mental impairment means dysfunction, lack of function, normal ways, which is called psychosis. A client has a problem relating to others. The client may have difficulty organizing thoughts. The person speaks in a disorganized manner. The person cannot organize the thoughts. Person speaks one thing at a time and another thing at the same time. That's type of disorganized thought process. Responses are inappropriate. When you ask something, the person responds you in a different way, which is totally unexpected way, which is also called inappropriate way. Communication is disturbed. Actually, there is no communication is taking place between the client and you as a support worker. The person is totally disturbed and the communication is totally disturbed. The person may withdraw. What do you mean by withdraw? The person is not going to eat anything. The person doesn't want to take shower. Person doesn't want to take medication. Just the withdraw of everything. Disorder of movement occur. Disorder of movement occur. Certain movement occur which is disorder. Person starts shaking the hand or leg in a bizarre way, in a different way, not in the usual way, in a typical way, which is not usually we see them. And some persons regress. Some person regress. So the person feels that he has done something bad. He was not supposed to do that, but he did something very bad. That's how they express their feeling. People with schizophrenia do not tend to be violent. Somewhere it is written, do not tend to be violent, but some of the places, people with the schizophrenic, they may be sometimes they might be violent. Bipolar and related disorders. See, another big mental health disorder is a bipolar. Bipolar. It is very, very violative. And this bipolar is also called manic depressive illness. Person have a suicidal thinking. Person wants to commit suicide, something like that. Bipolar, a group of related brain disturbances that causes unusual shift in the person's mood. Person's mood becomes unusual. See the word unusual, not the usual, regular way. In the person's mood, all of the sudden the person has changed the mood, and level of energy is also very fluctuating. Sometimes person has a good energy level, sometimes the person doesn't have. Person becomes very lethargic, very lazy, and very, like flat. And inability, energy shift, unusual inability, or ability to function. The person's ability to function is also being fluctuated, being shifted. In a shift in a person's mood, energy, and ability to function means the person is unable to function. Considered a long-term illness. All mental health illness are considered long-term illness, and bipolar disorder, it is definitely one long-term illness. Remember, we support worker may be feeling very difficult situation at this time, but don't get frustrated with that. You are not alone there working. There is a whole team member working with these clients. Therefore, you are always helped by other your team members. You are only one constituent part of the team who is working with this mental health disorder, the client with the mental health disorder. Now, the bipolar has two phases. One is called manic phase. Manic episode diagnosed if elevated mood is very high. Elevated means very high mood. Person is very active, occurs with the 3 or more other symptoms of mania most of the day. If the person has a elevated mood plus other 3 or more other symptom occurs, the person is considered to be manic phase. Mania, most of the day, nearly every day for 1 week or longer. When the person has a 1 week or longer, one is elevated mood and other 3 symptom or more symptom appears, that person is called manic phase of bipolar disorder. Occurs in the 3 phase. This bipolar disorder, it occurs in the 3 phase. Remember, first phase, second phase, and third phase. Occurs in the three phases. First phase is acute phase. Second phase is continuation phase. Third phase is maintenance phase. What happens in the acute phase? In acute phase, symptoms are escalating. It is coming very high. Very acute symptoms are seen. In continuation phase, when the symptoms are visible and the client is usually being treated, the client is hospitalized, or sometimes the client goes to the hospital himself or herself. Because the symptoms are visible, you can see the symptom, and client is usually being treated. This is the treatment process begins in the second phase of continuation. And in the maintenance phase, this is a phase of giving medication when the problem becomes manageable, when the client's acute symptom have subsided, means totally manageable. This maintenance phase means we have given medication, we have given proper care, and we have been able to manage their symptom, which is called symptom management. That's called maintenance. Sign and symptom of mania. So bipolar has a acute manic phase, and what are the sign and symptom of mania? Let's begin. Increase energy. When the person has a very active mood, increase energy, increase activity, person is all the time restless, activity, so much activities, and the person is restless. This is a restlessness, means person doesn't have any rest. Excessively high mood. Person has a very high mood. Person thinks that he can jump over the bridge from the house. From the 18th floor, he can jump to the floor and uh, to the ground, and he can run away from there. That's type of excessive high mood. Overly good. The person thinks that he is very good. Euphoric mood. Euphoric mood means like imaginary, unreal mood. Euphoric. The person feels that he is very relaxed type of excited mood. Euphoric mood means extreme irritability. Person is showing the symptom of irritation. That's called irritability. Irritation, full of irritation. Racing thoughts. Ideas in the mind are not coherent, not in a sequence, not in a logical order. That's the thoughts are racing. And very fast talking. Person can speak very fast. Very fast talking, jumping from one idea to another idea. See? It's called stream of consciousness. One idea, the person is talking about the religion, all of the sudden person goes to the coffee shop and talks to another person, something like that. Jumping from one idea to another idea. Distractibility. Person easily gets distracted. Inability to concentrate. Person is unable to concentrate, focus on one thing. The person does not focus on one thing. That's called distraction. It is extreme distractibility. Little need for sleep. Person is 24 hours talking and high mood and doesn't even feel the need of sleep. Means when people do not sleep, what happens? They are always restless. And that's called restlessness. Unrealistic belief in one's abilities and powers. The person thinks that he is the most powerful person in Ontario and he has the most power there. He's like a military leader, and that's the poor judgment because people speak without any logic. It's called poor judgment. So basically, the bipolar has a very high type of symptom called mania, and the mania has all these increased level of activities, restlessness, excessive high overly mood, euphoric mood, extreme irritability, lack of concentration or distractibility, no need for sleep, person doesn't want to go for sleep, unrealistic view of one's life, like the person thinks that he or she has a great power, like no other people have that power, and that's called poor judgment. That's a very poor judgment. And sign and symptom of mania: spending sprees, a prolonged period of behavior that is different from usual. Some people, they are demonstrating certain behavior which is not usual. Sometimes they are scratching head for a long time. Sometimes they are talking with the person in unusual way, using uh, difficult words. They sometimes verbally abuse other people, increase libido. They have their sexual drive, sexual desire is very high. They can sexually abuse healthcare worker at that time. That's called libido. Libido means the sex drive. They are sexually motivated all the times. Abuse of drugs, it's because they are abusing the drugs, and drugs abusers are always the bipolars and manic type of symptom. They are demonstrating those symptoms, particularly cocaine and those who drink alcohol, these alcoholic people, and sleep medication. Certain people, they take the street drugs that may be cocaine or sometimes drink alcohol and some sleep medication. They are showing those symptoms, and they are provocative. If you say something beautifully, because of that saying, they get provocative, and they can be like bombastic in that way. Intuitive and aggressive. They are very, very aggressive people, and they show the very aggressive behavior. Aggressive means they can abuse healthcare worker, denial that anything is wrong. They deny, they deny that anything is wrong. They feel that everything is okay. And for we, as a healthcare worker, we support worker, we know what is wrong and right, but they think that everything is right, and they deny that something is wrong. That's very difficult. For some time, we as a support worker, we feel so much frustrated while working with them. But the good thing is we are working with the team member, and we don't have to feel any bad with that, because it is their disease process. It's not the person whom we blame. It is their disease condition, and once they are given medication, once they are treated very positively, they can those sign and symptom, the violative sign and symptom, will be subside, and they will be normal person. So this is a hope we always have to have as a support worker. And how to support the client with the bipolar disorder. This is the biggest thing we need to know. This is the area we have to focus, and this is where your questions in the final exam will be selected. The support worker can assist in keeping a chart of daily mood symptom. Remember, the very first point is the daily mood symptom, how often the client demonstrates the mood change. It's called swing of the mood or mood swing. We have to note where how often the mood is being changed, and what are the treatments, what treatment are being given to them. We have to know about that. Again, what is their sleep pattern? How many hours a day or night they sleep? We have to record. And life events. Is there, what do you mean by life event? Is there anything life event is associated with their symptom, like their loved one dies or something happens, bad thing happens to them, they are financially bankrupt, or they are very, very poor, or something bad happened to them? We have to relate those with their life events. To see the life events and the support worker's prime duty, please go to the treatment phase and the role of the support worker in page number 780. You will be clarified. Therefore, when you read those, you are studying your slide. Please take all your books and the relative page number with you, and you will be going together with your textbook. Remember, your textbook is the most important book to pass the exam and to have the very good understanding of those chapters. Now we are coming to another disorder, which is called depressive disorder. Remember, I just want to remind you, in 2020, Canada will have so many people diagnosed with the depressive disorder. And what is the depressive disorder? A group of disorder in which the client has sad, say the mood is sad or empty or irritable moods. The mood could be irritable, empty, or sad. Accompanied means with, accompanied by physical changes. Certain physical changes occurs there, and thought changes. See, when the physical changes and thought changes occurs, the depression occurs that are severe enough to affect the ability to function. When the physical labor or their thought level are changes that affects the ability to function, the day-to-day life function. So what are the day-to-day life function? It's all about the activities of daily living: cooking meal, eating meal, preparing a meal, or changing the dress up, or cleaning the person, like personal hygiene, all the related ideas of personal hygiene, all these are activities of daily living. So the person with the depressive disorder, that person has three things in the mind: sad, empty, and irritability. And the person's physical changes occurs because their thought also changes, and the person cannot do anything of activities of daily livings, which we call ADLs. And also it includes major depressive disorder, premenstrual dysphoric disorder, substance medication-induced depressive disorder, and depressive disorder due to the another medical condition. See the types of depressive disorder. See, include major depressive disorder. This is a major depressive disorder when the person has sad or empty mood or irritable mood that occurs. Premenstrual dysphoric disorder. So we will discuss all about these clients later, all these types later. Premenstrual, before the menstrual cycle, a girl may have those dysphoric. Dysphoric means the full of the sweat, and that type of mental health disorder. Substance medication induced because of the taking the street drug, or that's the medication, those medication, they are causing depressive disorder. It is also called substance medication induced, means causing depressive disorder, or depressive disorder due to the another medical condition. When a person has a severe medical condition like heart attack or some cancer type of uh, uh, diagnosis the person has, and because of those condition person becomes depressed. That's called depressive disorder due to another medical condition. Major depressive disorder. So in the beginning, when we here we talk about the major depressive disorder, the same thing we are discussing here. What is a major depressive disorder? So always read the put the question mark at the end of uh, your topic, and you will, it's very easy to understand. So severe feelings of worthlessness. The person feels that he doesn't have any worth, no value at all. Person blames to the self blame. Sadness. The person doesn't have any enjoy of life. He feels sad. Disappointment. The person is not feeling restful, calm, and quiet. Person is full of disappointed. And emptiness. The person doesn't find anything inside him or her. This person feels that I'm empty, something like that. That last week, if it all these worthlessness, self-blame, sadness, disappointment, or emptiness, if it is this symptom remains for more than weeks, a couple of weeks, last weeks means couple of weeks, maybe 2 weeks, 3 weeks, the person is considered as a depressive. So the depression interferes with the activities of daily living. Again, the same thing is repeated. When the person is depressive, person doesn't do the activities of daily livings like eating, going, preparing meal, or changing dress, or socializing, making friends, talking to friends. These are the activities of daily livings. Person doesn't do that. May think about or attempt suicide. May think about, see, may think about or attempt suicide. I tell you very secret about the suicide. Once the person tries to commit suicide, the person will die because of the suicide. That's the mental health literature says. Depression is common among the older adult. Why is that? Because of the different disease condition, because of the death of the loved ones. Maybe the husband sometime dies before, or the wife dies before the husband, and they have those depression. And what are the treatment of those major depressive disorder, psychotherapy. What do you mean by psychotherapy? It is a psychologist, the psychiatrist, especially the psychiatrist. He he has a kind of discussion with the person. The person goes with the different discussion, life event, and the psychologist or the psychiatrist um, do the counseling with the person that could be helpful in some situation. Another is a drug therapy. The person is given different type of drugs for the symptom management. The person, after getting the drug, the person doesn't have those symptom of the sadness, emptiness, disappointment, and other symptom. And electroconvulsive therapy, which is called ECT, it means a stream of current is put in the brain and the thought process is changed by the electricity. That's called electroconvulsive therapy, which is very, very painful. Now let us begin the discussion with the seasonal affective disorder, which is called SAD. What do you mean by seasonal affective disorder? Seasonal affective disorder are the type of depression that occurs at the same time of the each year, usually in fall or winter, and ending in spring or early summer. See, seasonal affective, the season outside has affected the mental functioning of the person. Common in colder regions like in Canada. Colder regions, Canada or Northern Europe or Russia, these are the colder countries where this happens. Sign and symptom may be mild to severe, mild, moderate, and severe. The three type of sign. Mild is manageable, severe is unmanageable. And the condition is often mistaken for major depression. SAD is usually treated with phototherapy. See, there is a therapy which is called phototherapy, it is called. So basically when there is a season outside, it's very, very cold. Generally the winter season is a very common season for seasonal affective disorder. People have no movement, people have to stay at home, and because of that people feel so much depressed because of the weather outside. That's why seasonal affective disorders are weather induced type of disorder, and which is also the mental health disorder, but it is treated with the phototherapy. Other type of depressive disorder, disruptive, means very, very violative, disruptive mood, dysregulation disorder. See, dysregulation. Person does not follow any regulation, any rules, any system. Disruptive mood, dysregulation disorder. Mood is very, very disruptive, destructive, violative, always violative type of, without following any social rules and regulation, at the rules and regulation in the school, in the institution, at home, in wherever the person goes. It is persistent depressive disorder. Another is persistent. It means continuous, persistent depressive disorder. One is premenstrual, before the menstruation cycle starts. Dysphoric disorder, that girl has, usually the premenstrual is for the girls, the before the teenage. These girls may have this disorder. Substance medication induced depressive disorder. These are just the type of the different disorder. And our job is, whatever is the type of disorder, that is the medical condition, we have nothing to do with that. There are the doctors and the nurses and the family members who are basically focusing on what kind of treatment protocol, treatment style they want to follow. It's their decision. But our role here as a support worker is how to support them positively, how to positively express ourselves with those clients who have so many type of depressive disorder. We have to show that you enjoy being with the client. You have to show that you enjoy being with the client. You don't feel like frustrated when you are with the client. You are always enjoying. You have to show that. Be positive. Always be positive, be constructive. Think positively, be reflective, express your empathy. Know that the client may not know what she is depressed. Know that the client may not know that she is depressed. You think of the disease, not the person. Do not minimize the client's problem. The client may be telling something very important. Do not stereotype that the client with the depressive disorder always talking like that. Don't think like that. It's called stereotyping. Do not do it, or do not minimize the client's concern, client's problems. Encourage rest. The more they are restful, the less symptom they demonstrate. Proper nutrition. Nutrition helps them a lot. Activity. Involve the client in certain activity, some activity that makes their mind calm. Social interaction. If they can involve in something, some kind of social interaction type of discussion with other people, let them discuss. Be alert for warning sign of suicidal intent. If the client is committing suicide, thinking of suicide, the client will tell you. The client will give the personal belongings to other people because the client thinks that he or she feels very empty, meaninglessness, fruitlessness, valuelessness of life, nothing is there. Please see the box number 35-4, page number 784. That gives you more idea about that. And provide a safe, secure, stable environment. We have to, it is our duty to provide them safe, secure, not risky but secure and stable environment. They should feel very, very comfortable and stable inside the living room or the house or the hospital room or the long-term care. Follow the care plan. It is our prime duty to follow the care plan because what is mentioned in the care plan is made with all the healthcare professional prepared by the nurses, and we have to follow the care plan. Ensure safety. Safety is always the prime focus here. And encourage the normal activities. Once person is busy with the normal activities, the person has no time to show the abnormal activities. Therefore, the more we can encourage for the normal activity, better it will be. Now we are shifting our discussion to the anxiety disorder. I have a question to you. Do you have anxiety? You may have, but I have anxiety. Anxiety at a certain level is not bad, but anxiety in a chronic level is very bad. It is considered mental health disorder. Everybody has anxiety, but they are not having the mental disorder. Anxiety at certain level. I want to drink a coffee. The Tim Horton is a little bit far away from here. I have the anxiety of walking in the cold. That's okay. That's not very bad. But when the anxiety is interfering our way of life, our thought pattern, it is very, very difficult. It is very, very confusing. Anxiety is a vague. Vague means a little bit confusing, uneasy. It's a uneasy feelings in response to the stress. When people have a stress, they have a uneasy feeling to respond the stress. They are unable to manage the stress level. Often, anxiety occurs when needs are not met. When people's needs are not met, people may have certain anxiety. Some anxiety is normal, as I said you. Some anxiety is normal, which is I say which is good. Because of the anxiety we go ahead. Client with mental health problem have higher level of anxiety. Okay, the higher the level of anxiety, the more difficult to manage it. That's why some anxiety is normal, but the higher level of anxiety is not normal. It is called abnormal. Sign and symptom depend on the degree of anxiety. See, the degree means the level of the higher level, the depth of anxiety. If people have very, very severe anxiety, they cannot even move. Many anxiety disorder can be treated with medication. And the good thing is anxiety can be treated with medication. It subsides. Now, panic disorder. What is a panic disorder? A person is in the situation of not knowing what to do and what not to do. That's the panic condition. And in a panic disorder, that's the sudden feelings of fear, anxiety of something bad. Panic is an intense and sudden feelings of fear, anxiety, terror, dread. For no, dread means very, very bad, fearful, no obvious reason. People may have anxiety, panic disorder. The physical symptom of fear, shortness of breath. See, when people have a panic disorder, they show certain sign and symptom at physical level first. The shortness of breath, racing heart, the heart rate increases, and dysphoric, they are sweating, their body is sweating, escalate very quickly. It means it develops. Escalate here means develops. It develops very quickly. Escalates very quickly when a client has a panic attack. When a client has a panic attack, what happens generally at physical level? Shortness of breath, 1. Racing heart, 2. Sweating, 3. And when client has a panic attack. Panic attacks can happen anytime, anywhere, and without warning. It is all of the sudden, out of the blue, the person has those signs of panic attack, which is very bad. More common in women than in men. Woman has more panic attack than men. Very sad thing. Now, phobic. Phobic means fear, disorder of fear. Person has a fear of so many things. Phobia means fear. Hydrophobia, fear with water. Gynophobia, fear with women. Panic or dread. Clients who struggle with phobias often feel embarrassed and stupid. They feel embarrassed. They feel very, very shy. They feel humiliated. Common phobias. Agoraphobia is a fear of open, crowded public places. Those people with agoraphobia, they cannot give a public speech because they are full of fear. Claustrophobia, it's a very, very narrow place. They don't want to go to the narrow place. Fear of small enclosed places. They cannot go by the tunnels because which is very narrow. And this is a small cluster, small part. They have a fear of that. Symptom of phobic disorder. Let's discuss about what is the phobic disorder and their symptoms. Excessive worry. Person is very, very worried. Sleep disturbance, disruption from worrying. Person even cannot sleep during the night because of the worry. Person has so much worry. Fatigue means tiredness or irritability. Person is full of restlessness. Difficulty concentrating. Person's mind is totally diverted with the fear. Therefore, person cannot focus on something. Difficulty concentration. Physical symptom much as increased sweating. See, the person's face could be sweating, body could be sweating. The hand, if you see the hand, the palm of the hand, it's full of the sweat. Heavy breathing. Irregular heartbeats, palpitation, which is called Irregular heartbeats sometimes very, very fast, sometimes very slow because of the fear. Dizziness, faintness, sometimes person feel dizzy or sometimes person faints on the floor. Muscle pain, this is a muscle spasticity, muscle pain, all of the sudden the neck muscle, the thigh muscle, everywhere pain, tension, and even diarrhea. See, person even have a diarrhea. The gastrointestinal system is also affected by the fear. From the interference with digestion, see, the digestion is also interfered by certain type of fear. Other type of anxiety disorder, separation anxiety disorder. Small child are having those disorder when they are sent to the daycare. They have a separation anxiety with their mummies, mothers, daddies, fathers. Separation anxiety disorder, persistent and excessive. Persistent means continuous, all the time, and excessive, very much worrying about losing major attachment figure. For a 3 years old toddler, um, separation with mother in the daycare is always a kind of anxiety, but this is a normal. That's not the anxiety disorder, but that is only the anxiety. But here we are discussing about mental health disease. It is a totally disorder. Selective mutism lasts for a month or more, where the client experiences a consistent inability to speak. Mutism means unable to speak, mute, unable to verbalize. Mutism means just keeping silent. In social situation, person cannot speak in the crowd of people. The person has confused with the words, person cannot be able to speak with other people. And social anxiety is a severe distress in social situation. People cannot go to take part in the party, birthday party or whatever party, or the among the friends, they cannot go there, they cannot go to school, college, in the job place. Because of this different type of anxiety disorder, people have a difficult life situation. And uh, thank you for your patience listening to this lecture. You have a second part of this lecture after you finish this reading. Thank you so much. Have a great time.